Hello everyone, dear friends. The holidays have flown by, so I can't really say it's the new year anymore. I'd like to say it's a new life, but no, life is the same. So, we keep working. Let me remind you once again, a very warm welcome to all of you who have just joined our channel today. We specialize specifically in treating the complex musculoskeletal system, and we take great pride in making these educational videos. Right now, at this very moment, we are in the middle of filming a detailed video about the practice of manual therapy. Just at this moment, we are pleased to have a new visitor who has come to us for a consultation. Patient Maria, 23.
I work as a videographer, a camera operator. I'm constantly filming, so I always have a camera or a phone in my hands, and my shoulders are always in this position, kind of hunched, and in the back I have, let's say, a hump growing, you could say. I had an MRI 2 years ago, and they diagnosed me with osteochondrosis, or rather suspected osteochondrosis. And I also suffer from lumbar lordosis. Every single day in the evenings when I finally come home from work, my arms and my legs are always aching, hurting, or feeling incredibly sore.
All right, good. Well, I certainly won't say right here and now whether it's a major mistake or not, but those of you who are already faithfully subscribed to this channel and consistently keep a very close eye on all of our latest videos already know quite well that a professional massage is definitely going to be massage isn't therapy. This specific therapy as a form of physical therapy or as a standalone monotherapy. All of this only has a temporary effect. We have a few notable high-performing overachievers who use ESWT, either as ESWT or as monotherapy. All of this only has a temporary effect. We have some overachievers who write comments. Basically, they are right. That's why I never even remove this from the recommendations. The recommendations always state that you need to do therapeutic exercise. That is the OFC recommendation. And does your job make you sit for long periods?
Sit for long periods? Yes, there are times, because besides filming and walking around, I also edit at home.
On the computer. Editing, yes, it is honestly really tough, I will say that right away, because we shoot videos for a living. It is actually quite hard to say whether it is easier to go out and shoot a video or to stay inside and do all the editing. But when I once saw with my own eyes how the complex editing process goes, I won't say anything more. There, I said everything I needed to. But here I won't say anything else at all. Otherwise, half of this entire video would probably have to be beeped out for the audience. Alright, good. That's basically it. We did the MRI. It's a pity we don't have the MRI results, but let's just take the patient's word for it. And basically, as you may have noticed, that I'm not saying it's right, but it often happens that patients come without any test results, but there's nothing you can do about it. In this case, you just examine them and already get a sense of whether you can work with it or not. No MRI results. Trust the patient, examine them, and decide if you can proceed. A certain list, by the way, includes in the recommendations that an MRI scan is necessary. So, I think that's it. In principle, we're moving on to the examination, right? Well, let's proceed. So, dear viewers, we're ready to move on to the diagnostics, but there's one thing. If you want to watch the full video, you need to follow the QR code, because these videos, the full uncensored versions, YouTube, this is something that we simply won't allow to happen. So I will be looking forward to seeing you there on Boosty very soon. Move a little bit closer now. Position yourself right under the head. Well then, my dear editor, I wish you the very best of luck with all of your difficult work ahead. Now, please turn over slowly. Just try to relax your body completely, even more than you are right now. Other side. Unexpected? On your back. Other side. Surprised? It's like an unexpected washing machine. Turn over onto your back. Put your right hand on the left shoulder and the left on the right. And shower. focus on the upper thoracic area of your back. Now just let go and relax completely. Does that feel a bit scary? It is okay, just give me your hand for support. Now slowly sit up, move your body back, move back towards Antoine. Now we are going to carefully interlock our hands together right behind the back of the head. It's impossible not to notice the nails. Moving back towards Antoine now. We slowly interlock our hands together behind the head. Honestly, it is completely impossible not to notice those nails, rounding out the movement. All right then. Or not all right? Well, if it's not all right, then...
It's not all right.
Okay, lay on your back. We're going to do decompression now, shall we? Yes, yes. Is someone actually talking to me? Bets are placed. No more bets. Alright then, that is finished and everything is done. We are now carefully securing the back of the head and the chin area to ensure everything stays in place. Please, we need someone to just relax and stay calm. It is very important that someone tries to relax completely while we are finishing up these final steps. We find ourselves constantly seeking more, striving for an even greater abundance, and relentlessly pursuing an ever-increasing amount of everything that we desire in this life.
There is even more to see here. Certainly.
Did you know that the pelvis of men and women is different?
Yes.
Why?
The female pelvis is wider than the male pelvis.
What can you do that I can't? Give birth, right? That's brilliant. What's my point? That a blockage often forms in the hip joint. It's more common in women. Again, because of the physiology of the pelvis. The other leg as well. There is a very tight band of muscle right here, so you really need to take a moment to stretch it out. Pelvic physiology requires the other leg stretch too. Relax. This stretch targets flexibility, not joints. That is, the leg should lie down easily. If you don't do this, what awaits us? Restricted mobility in the joint. Discomfort may appear. A common joint-related problem. Relax. Ensure the leg lies flat to avoid joint stiffness and pain. It becomes increasingly difficult, and the patient gradually begins to lift up the opposite side. Are you feeling relaxed now? Okay?
Yes.
Turn onto your stomach and get onto your forearms. Try to roll over. It's already difficult. The patient starts to lift in the opposite direction. Well, again, this could be due to genetics, so there's no need to blame anyone here. We're doing a stretch. Alright, good, you can relax your legs. And your arms. For your arms, you need to stand up. Stand up, stand up. Basically, we can move on to the control test. What was your height on your forehead? 167. 167. And before that, before the measurement, 170. Your current session has now ended.
Yes, my session is over. It felt unusual but interesting. I can say that I feel much more, let's say, alive after the session. It's like I was reborn.
You feel lighter.
Yes, I feel lighter.
And you'll never end up at the traumatologist's, well, I mean under normal circumstances, nor at the vertebrologists, nor the neurologists, or anyone else who works with the musculoskeletal system. Recommendations will be given. If you want to look good with a nice, do it. Normally, you won't need specialists for your body. Here are recommendations for beautiful posture. Be sure to subscribe, it's only going to get more interesting, as I've already said. And thank you so much. Thank you. Goodbye for now.